Greetings, I am Dr. Sharetta Remikie, and I serve as the Director of Maternal Infant Health here at the March of Dimes. We are definitely in a movement. We need that movement because the U.S. has the highest maternal death rate among the world's most developed nations. Every 12 hours, a woman will die from pregnancy-related causes. The U.S. maternal mortality rate has more than doubled. Over 700 women each year die of complications related to pregnancy each year in the United States, and 2/3 of those deaths are preventable. In addition, more than 22,000 babies in the US die before their birthday, their first birthday. That is 2/3 every hour. Also, maternity care deserts exist. They are counties in which access to maternity health care services is limited or absent, either through the lack of services or barriers to a woman's ability to access that care. We have a problem. But not only that, problem gets even heightened if you're a Black woman. Black women are at a higher risk to have adverse birth outcomes in the United States. Black women are 3 times more likely to die from pregnancy-related causes than white women. And Black babies are twice as likely to die before their first birthday. This information may sound new to many, but it's not. For over 401 years, Black communities have faced inequities as a result of systemic racism. 86% of the African-American experience in the US has been either as enslaved or under Jim Crow. So from slavery to the civil rights movement, even factoring in today, the standard of living, barriers to care, and access to quality nutrition, just to name a few factors, have created an unacceptable reality in our country. We have a health equity gap. In Florida in 2019, we had over 220,000 babies born. According to the March of Dimes 2020 report card, Florida received a grade of D+. That's because 10.6% of our babies were born preterm. So why is this statistic important? It's important because preterm birth is one of the leading causes of infant deaths. And infant death is an indicator used to measure how well a society is doing and thriving. So therefore, preterm birth is very important to our communities. But not only is it important, but let's look at it. It has also some financial implications. Preterm birth in the US costs approximately $25.2 billion per year. That's $65,000 per birth in the United States. In Florida, we got a data where we were around the average of $64,525. So if we put all the numbers together, Florida number of preterm births were 23,345. If we had 23,345 preterm births in Florida, that cost our state $1.5 billion. That's right, billion with a B. And those estimated societal costs for preterm birth includes medical care for premature children, maternal delivery costs, loss of productivity. They also, which is important for our discussion today, was early intervention services and special education services. So it's not only a health issue, it's also an economic issue. So what must we do? We must end preventable maternal health risk and death, along with ending preventable preterm birth and infant death. And the only way we can do that is ending the health equity gap. So there's a couple of steps on how we can end the health equity gap. We have to expand and maintain access to health coverage, provide patient-centered care that is responsive to the needs of women, especially Black women. Address the social drivers of health, those things that are determining and driving that some people are more healthier than others. We have to expand access to quality, patient-centered, and comprehensive reproductive health care. Expand and protect access to trusted community providers. Expand protections for pregnant women and workers, and invest in healthcare safety and quality improvement initiatives. We also cannot forget the fathers. Fathers are important. We see a lot of data that says father's absence causes poor outcomes for children. Father absence disproportionately affects Black and Hispanic children. The relationship between the mother and a father at birth affects father involvement later on. But the most important thing that we need to, when we're talking about fathers, is not just their involvement and their presence, but also their health. Because fathers with chronic physical and mental health issues have higher incidence of poor birth outcomes. So we have to take care and give attention to our fathers. So we know the fathers are important. We know we want healthy moms and babies. So we gotta remember this. We can have an impact on the future by promising to be a part of the change. We can promise to embrace this statement, which I love to use a lot, which says, respecting the woman as an important and valuable human being and making certain that the woman's experience while giving birth is fulfilling, empowering, and not just a nice extra. It is absolutely essential as it makes the woman strong and therefore makes society strong. Therefore, I'm admonishing everyone to commit to efforts and resources that will help in evening the playing field so all moms and babies can be healthy, happy, and thrive. If you would like to continue discussion or learn more about how maternal infant health impacts our world and impacts our society, you can contact me or you can reach me at 954-980-3694. Thank you for this opportunity and have a great day.